Hi, my name is Ruhi, and I will be discussing differential reinforcement with you today. We will go over what a DRA and a DRO are, look over examples of problem behavior they were used to treat, how to implement them, and guidelines on how to use them. The first differential reinforcement strategy is differential reinforcement of alternative behavior. It's when functionally equivalent target behavior is reinforced while reinforcement for problem behavior is withheld. The second is differential reinforcement of other behavior, where reinforcement is contingent on the absence of problem behavior. For example, in a set interval, you reinforce if problem behavior is not seen. Differential reinforcement is one of the least intrusive methods. There is no interruption of activity. It does not remove positive reinforcers. There is no presentation of aversive stimuli, and it's effective and commonly used to reduce problem behavior. For example, a DRO was used to reduce toe walking in a typical 5-year-old child. Absence of toe walking was reinforced with a token with backup reinforcers and verbal reinforcement. The graph on the right shows a significant decrease in toe walking during intervention. In another example, disruptive behavior of 7 typical children was decreased using a DRO. An edible and verbal praise during a set interval were delivered. In the absence of disruptive behavior, they saw a significant decrease of problem behavior during circle time. A DRA was used to treat pica in a 13-year-old girl with ASD. She earned reinforcement for discarding pica items in the trash instead of eating them. The graph shows an increase in discarding and a decrease in pica. A DRA was used for disruptive behavior in 7 to 8-year-olds in a classroom. An FA showed that disruptive behavior was attention maintained, so they earned reinforcement for hand raising. Researchers saw a decrease of disruptive behavior in all participants. Next, we will be talking about how to implement the intervention. The first step is to identify the target problem behavior by looking at its topography, frequency of occurrence, intensity, where it typically occurs, and its duration. The next step is to identify the function of the behavior using a functional behavior assessment. You can start with indirect methods like questionnaires or interviews, and then if possible, conduct a functional assessment to clearly identify the function. Step 3 is to choose a data collection method to assess the target behavior. Depending on the behavior, data can be collected using frequency, topography, intensity, severity, and so forth. Use the selected method to collect baseline data. The next step is to conduct a preference assessment where preferred objects and activities are identified. To gather items for the assessment, conduct an interview with professionals or family members or observe the client. The assessment can be formal or informal. Next, choose your differential reinforcement procedure, a DRO or a DRA, depending on the replacement or absence of problem behavior. Then determine the schedule of reinforcement, interval between reinforcement if necessary, and a timeline for data collection. After implementation, collect data on the target behavior and alternative behavior if necessary. If goals are not met, modify the treatment, then compare it to the baseline and the original treatment. Once treatment is successful, then the schedule of reinforcement. A DRA is successful if alternative behavior is already in the client's repertoire. It requires equal or less effort than problem behavior, occurs often enough to meet reinforcement, and if it can be reinforced in the natural environment after termination of the intervention. An example of these guidelines in practice is in a center-based classroom where students were taught functional classroom behavior. It required equal or less effort than disruptive behavior, occurred often enough to meet reinforcement, and could be carried out in a natural classroom setting. A DRA is not recommended as a single intervention if it impacts the client's health or is a danger to the client or others. It is also not recommended if the problem behavior is severe, as is the case with SIB, and a time-sensitive response to the problem behavior is required. When using a DRO, set intervals that allow frequent reinforcement. You may wish to use a momentary or interval DRO. An interval DRO is more effective at suppressing problem behavior, whereas a momentary DRO will maintain reduced levels of a problem behavior. A study done comparing interval and momentary DRO in a classroom of 22 preschool-age students who displayed a high rate of disruptive behavior showed that an interval DRO produced a larger decrease in problem behavior. A DRO may reinforce other undesirable behavior that occurs during the interval. This would require a revision of the operational definition of the problem behavior. A DRO is also not recommended for severe problem behavior that requires immediate intervention. Thanks for watching!